I think rheumatology, simply put, is the study of pain in the bones, joints, soft tissues. We're the doctors that treat inflammatory arthritis like lupus, rheumatoid arthritis. We treat a lot of autoimmune disease. These are sort of rarer diseases, but we are the physicians that help patients whose immune systems are in essence attacking themselves. The diagnoses can be difficult. We tend to draw a lot of labs because we have to look at the patient's antibodies that sort of lead us to a diagnosis. And because our patients can be very complex, it's not a simple diagnosis. If you can imagine a patient with multiple chronic diseases like diabetes and say they have nerve issues, and then they show up with an autoimmune disease on top of that, it can be very difficult to sort out what's actually going on, and it can also be difficult to figure out how to manage it. So Carolyn and I, on our more complex patients, we will bounce ideas off of each other. Do you think this is the right diagnosis? What would you do differently, or can you think of anything we would add? We work very hard to have a team environment in the clinic, from the providers to the janitors. It's really important that we all work together. The team is critical. One thing about rheumatology is it is art and science put together. A lot of art of medicine in diagnosing a patient requires a lot of thought, analysis, and listening. That's my job. It's my pleasure.